Postpartum thyroiditis. What is postpartum thyroiditis? Postpartum thyroiditis is an inflammation of the thyroid that affects about 1 in 20 women during the first year after giving birth and is more common in women with type 1 diabetes. The inflammation causes stored thyroid hormone to leak out of your thyroid gland. At first, the leakage raises the hormone levels in your blood, leading to hyperthyroidism. The hyperthyroidism may last up to 3 months. After that, some damage to your thyroid may cause it to become underactive. Your hypothyroidism may last up to a year after your baby is born. However, in some women, hypothyroidism doesn't go away. Not all women who have postpartum thyroiditis go through both phases. Some only go through the hyperthyroid phase, and some only the hypothyroid phase. What are the symptoms of postpartum thyroiditis? The hyperthyroid phase often has no symptoms or only mild ones. Symptoms may include irritability, trouble dealing with heat, tiredness, trouble sleeping, and fast heartbeat. Symptoms of the hypothyroid phase may be mistaken for the baby blues, the tiredness and moodiness that sometimes occur after the baby is born. Symptoms of hypothyroidism may also include trouble dealing with cold, dry skin, trouble concentrating, and tingling in your hands, arms, feet, or legs. If these symptoms occur in the first few months after your baby is born or you develop postpartum depression, NIH external link, talk with your doctor as soon as possible. What causes postpartum thyroiditis? Postpartum thyroiditis is an autoimmune condition similar to Hashimoto's disease. If you have postpartum thyroiditis, you may have already had a mild form of autoimmune thyroiditis that flares up after you give birth. Postpartum thyroiditis may last up to a year after your baby is born. How do doctors diagnose postpartum thyroiditis? If you have symptoms of postpartum thyroiditis, your doctor will order blood tests to check your thyroid hormone levels. How do doctors treat postpartum thyroiditis? The hyperthyroid stage of postpartum thyroiditis rarely needs treatment. If your symptoms are bothering you, your doctor may prescribe a beta blocker, a medicine that slows your heart rate. Antithyroid medicines are not useful in postpartum thyroiditis, but if you have Graves' disease, it may worsen after your baby is born and you may need antithyroid medicines. You're more likely to have symptoms during the hypothyroid stage. Your doctor may prescribe thyroid hormone medicine to help with your symptoms. If your hypothyroidism doesn't go away, you will need to take thyroid hormone medicine for the rest of your life. Is it safe to breastfeed while I'm taking beta blockers, thyroid hormone, or antithyroid medicines? Certain beta blockers are safe to use while you're breastfeeding because only a small amount shows up in breast milk. The lowest possible dose to relieve your symptoms is best. Only a small amount of thyroid hormone medicine reaches your baby through breast milk, so it's safe to take while you're breastfeeding. However, in the case of antithyroid drugs, your doctor will most likely limit your dose to no more than 20 mg, mg, of methimazole or, less commonly, 400 mg of PTU. Thyroid disease and eating during pregnancy. What should I eat during pregnancy to help keep my thyroid and my baby's thyroid working well? Because the thyroid uses iodine to make thyroid hormone, iodine is an important mineral for you while you're pregnant. During pregnancy, your baby gets iodine from your diet. You'll need more iodine when you're pregnant, about 250 micrograms a day. 1 Good sources of iodine are dairy foods, seafood, eggs, meat, poultry, and iodized salt with added iodine. Experts recommend taking a prenatal vitamin with 150 micrograms of iodine to make sure you're getting enough, especially if you don't use iodized salt. 1 You also need more iodine while you're breastfeeding since your baby gets iodine from breast milk. However, too much iodine from supplements such as seaweed can cause thyroid problems. Talk with your doctor about an eating plan that's right for you and what supplements you should take.